Hi, I'm Dr. Steve Haley. I'm one of the chiropractors here at the Center for Health and Wellbeing. And today we're just going to do a really quick, simple video on doing some kinesiotaping. Kinesiotaping, KT tape is a brand, but the idea of physical therapy tape or kinesiotape for injuries is pretty widespread within the physical therapy, chiropractic world, acupuncture world. So there's a lot of different brands. I won't get into them. They pretty much all are going to be suitable for yourself at home and what you're going to be applying for. Today we're going to do a knee taping. So you might want to tape your knee or have somebody tape your knee if you're dealing with patellar tendonitis, if you're dealing with some knee injuries of some support. The idea behind taping and this spongy, stretchy tape is that it provides support, but not support in the terms of restriction of motion like you might think of athletic taping, like say a basketball player who tapes up his ankles before a game. That's more restrictive and it prevents an actual sprain. This is actually going to be supportive. It's going to give some support to the muscular structure in the joints. At the same time, one of the big things that it does is it actually lifts up some of the dermal layers and allows for greater blood flow. So it allows for faster healing and support. So the knee is one of the techniques and one of the ways in which I tape in the office. And we've gotten some really great results with it. People are really happy. Again, dealing with some patellar tendonitis, Osgood-Schlatter's disease for young athletes, chondromalacia patellae. Those are different things that you might hear, and those are things that can respond pretty well to this. It's not curative, it's palliative, but it can be extraordinarily helpful. Some things that you want to keep in mind before you tape yourself, or if you're going to tape a friend or whatever, is you want to clean the skin as best you can. Especially some people might have lotions on or perfumes and whatnot. So just a quick little alcohol swab over the areas in which you're going to be taping can be very helpful. So we'll tape your right knee. Is that okay, Cheryl? This is Cheryl. She's here at the center as well. So we're just going to go ahead and clean the skin around the knee. Really simple. Get that out of there. When you use the tape, you want to make sure you round the edges. So we'll do that as I'm actually applying it. So we're going to be using two larger straps. We're going to be coming across here and one across this way, and then a second one mirroring that just to the other side. This gives the quad some support. It also gives some support to the lower portion of the knee where the patellar tendon is. Okay, so we're going to give a quick measurement. And we'll just double this up. So if you've ever been wondering when you're at the gym and you see all this crazy colored stuff that people are putting on, that's what this is. There's several different brands that are out there. Again, for the application and the purposes, I think all the brands are just fine. So we rounded the edges because that prevents it, or it doesn't prevent it entirely, but it minimizes, say, catching on clothing, and the clothing will start to undo the taping job. A good taping job should last about 4 to 5 days, not 4 to 5 days. I've had patients where it's lasted upwards of a week. The way that you can take it off is you soak it in some baby oil, get some baby oil put on it really well, and take a nice long bath. If you start to get a skin reaction like itchiness, things along those lines, I recommend you take it off a little bit early. Okay, so we're just going to go ahead and we're going to give ourselves a little anchor piece. We want to try to touch it as minimal as we can. We're just going to put that right there. And we just go a little stretch, not too crazy. Okay. And then we're going to take our second piece here. Bubble in there, just try to push those out. And you want to have, when you overlap pieces, you want to have them overlap like so, not like this, not having their ends just right there together, because if it starts to peel, it's going to peel both of them at the same time, as opposed to along this, one starts to peel, you can just trim it. And a great way to trim it is just those little tiny cosmetic shears, really small little tiny scissors. That's a great way to trim these up. You give it a good rub. I'm not going to really rub this in deep. The rubbing it deep gives it the glue, the activation that needs to hold for a while. Cheryl's not dealing with an injury, and we're just using her as a fantastic model here for this. So we want her to be able to probably take this off tonight. You know, she'll take a long hot bath and get that off of there. Then another great place to put another piece of tape, and it's not always necessary, but if they're dealing with pain here at the inferior portion of their patella, right here where the tibial tuberosity is, that's what this is called, this little bump right below the knee. It's a great idea to put another piece, a strapping piece across that. That can be supportive and also can help with some of the pain. Again, we want to round the edges. In this case, we'll tear it in the middle. We'll do about a 25 to 50% stretch. So I'm gonna have to get down here in front of the camera. And we're just gonna place this right across that little bumpy spot right below where the kneecap is. Just put that there. And then again, you would want to give it a fairly vigorous rubbing on the tape itself. Some of the tapes will allow you to utilize some topical pain creams. And one of the tapes that I like it's rock tape, and that's one of the reasons why I like it, because rock tape makes a thing called rock sauce. They make it their fire brand, and you can actually rub that into this and it acts as a pain patch, and it won't denature the glue and make it come off quicker. So if you're looking for a brand that at least myself, not the center, stands behind, that's the brand that I like for that reason. Not that the tape is so much better, but because it allows for you to put that substance on there and actually create somewhat of like a little, like a salon paw or a lidocaine patch, something like that. It's just using their sauce called rock sauce. It's in a red container, and that actually will help some surface pain relief. So that's it. That's a quick taping technique for the knee. A lot of other taping techniques, and we'll probably get into those down the road. Thanks very much for watching.